Thanks so much, Omar. And hello, everybody. My name is Selena Gore. I am the CEO of Women Heart, and we are the largest patient-centered organization focused exclusively on women living with or at risk of heart disease. I have the honor of welcoming you all to session 5, entitled AI, an intervention point for patient-centered decision-making. This is really an issue that's at the core of what Women Heart does and something that I'm personally passionate about. So I'm really excited to be speaking with Dr. Hall today. She is our speaker for this session. She is the Chief of Data Science and the co-director of the Institute for Precision and Cardiovascular Medicine at the American Heart Association. Dr. Hall leads groundbreaking initiatives in cardiovascular medicine by leveraging data analysis, new technologies, and strategic alliances, all at the intersection of health, technology, and science. Dr. Hall is supported by a diverse team of experts in data science, health research, metrics and evaluation, health technology, and products. I really have the pleasure of inviting Dr. Hall to the stage.
Well, thank you. It's really a joy to be with all of you, and I've learned so much just from listening to everybody today. And every time I see that picture of myself, I just cringe because it's such a fake, like taken like 10 years ago, and then you see me and you're like, oh my God, she's so old. So I'm definitely going to get a picture taken and then like age it with technology. And so then when you see me, you're like, oh, wow, amazing, right? So anyway, thank you again to the National Health Council for having me today and allowing me to meet such great people, the people at my table, just the people I've had the honor to meet today. It's just been really fantastic. So I'm going to give a brief, I'm going to give probably about a 20-minute talk today, but I'll give you a clue when we're getting close to the end on an intervention point for patient-shared decision-making. And then Selena and I are going to have a conversation about some questions that are hopefully kind of on the tip of your tongue or what you've been thinking about after you've listened to most people today. So these are the key messages that I hope to leave you with today, and that is everything that the American Heart Association does through our CEO and our group of staff and our 40 million volunteers is through the lens of health equity. And today I have learned that I'm never going to say that word health equity again without thinking about all of these patient advocates that we've had up here today, because that has really taught me a great deal. But we're going to start by talking about AI enabling providers to spend more time with patients by improving efficiency and reducing tasks. So I'm going to give you some examples of that. Secondly, how AI enables a patient different opportunities to interact and to better understand. And again, how do we think of that through this lens of health equity? How does AI holistically make a difference by training providers, activating patients, and working with communities? And I hope to give you an example of that through the way that the American Heart Association thinks about things, through communities and through advocacy and through activating patients. And you've seen so many examples of patients who are so activated to stand up for their own health today that I think that's a lasting sentiment. And finally, AI is improving standard of care by patients for decreasing time from diagnosis to treatment and improving accuracy. And I think you've seen a lot of examples of that, but I'm going to give you a few use cases that are a little bit closer to home. So AHA likes to use this slide, and I'm going to transform it, I hope, into a slide that thinks a little bit more about AI. But think about the top as being health equality and the bottom as being health equity, right? And so if you just look at that very carefully and think that the bottom is more towards fitting technology to the people that are utilizing it, right? And transforming it into, I thought Chris Gibbons had a great statement today, I can't find you, Chris, but your statement about design was so critical and just really, I think, hit home about how do we design things for people so it's easy to use. And it should be easy. And so we want to keep thinking about this. Secondly, how do we think about health equity when we're thinking about algorithms and AI? We can think about it in every single state, from the data that we put into the algorithm, from the algorithm itself, through the validation, and every single step along the way, health equity comes into play. So we never want that to leave our scrutinization of all these tools that we're thinking about. This one, my eyes are too bad because I can't read it from up here and I don't have my cheaters, so I'm gonna turn around. But this one is a very sciencey clinician slide, so I'm not gonna spend much time thinking about it or telling you about it today, but just know that there's all these inputs on the left-hand side about data. And you've heard a lot about that today from, that data comes through your phone, that there are apps now, and that there's inferential data that's happening. I think that was from Nicole that talked about that this morning. It was a really, really remarkable talk that she gave. And some of the data that's coming through that people are already picking up is the way that you interact with your phone. So they're thinking about how your mood is by how many words you respond to a text, how your voice sounds on a voicemail, how you respond to Siri. All those things are being taken into account. And those things are going to come into AI and machine learning algorithms as well. And they're going to go through these models, supervised learning, deep neural networks, unsupervised learning, and reinforcement learning. And they're going to come out on the other side to give us the tools and technologies that we have today that are going to hopefully improve healthcare and are already improving healthcare today in many instances. So how does AI improve the time providers spend with patients? So in 2021, Microsoft acquired an AI company called Nuance for $19.7 billion. And this company, what this company does is it captures and conceptualizes and documents every word between a healthcare worker and a patient. And you might say, is that worth $19.7 billion? But yes, it is. Because why? Because that allows the clinician to not have to document and go home and do all of that note-taking, because it allows the patient to spend more time with the provider and the provider to listen and watch the patient for what those clues are, right? That they're not catching when they're too worried about putting it into the EHR, what they have to check off on the EHR, and all the different note-taking. And the burnout that's happening in healthcare today, this is also reducing that healthcare burnout that's happening. And it improves the time of healthcare workers with patients overall, even with the nurses. And so again, this is one great thing that's happening for patients, not something that the patient is seeing, but it's happening behind the scenes. So again, here's another example. So this was recently published in JAMA International Medicine, and it's a little bit tough to understand, and it's very early, but this is comparing physicians to chatbot GPT, right? And I thought it'd be a little bit fun and fun to show you this. But the gray box is AI, and that's the chatbot. And the blue box is physicians. And the farther you get to the right side, the better. So in empathy, when they're asked very different questions, right, and the patient asks a question to the chatbot seems to be doing a little better than the physician in even empathy, right? Not for all questions, but for some questions. And then even the quality of the answer was coming back a little bit better early on for chatbot GPT. So, take this with a grain of salt, because this is, 10 questions, but it's an early result that suggests that even chatbot GPT can have some empathy When we thought, oh, we as, people, we have this leg up on ChatGPT because we have empathy. Well, no, it's actually better than us at empathy. So another way, how can AI tools like chatbot GPT, and I'm not going to focus on that forever because it's just one small tool today. But we have to teach, and some of our nonprofits can help in this regard, to help patients and help families and help caregivers learn how to ask the right questions to these different tools. So how can we help them? So American Heart Association writes the guidelines with the American College of Cardiology for cardiovascular care. So we can help them by saying, you can ask ChatGPT, what would the guidelines say for treatment of my high blood pressure, for example? It's small things. We're not going to move mountains overnight. It's going to take a lot of time, but you can help guide them to what questions to answer and what questions to ask. This is happening all over the world. If you ask, if you have a son or daughter that's doing a PhD, that ChatGPT could write their dissertation. Yep, it could write a grant. It could write my talk today. It can act like me. It can, Dr. Califf said it himself, it can have his voice, his head, everything up there, and it sound like him as well. So what we need to do in our institutions is help people understand how to ask the most discerning questions and learn how to interact with these tools. So the pillars of our work at the American Heart Association are really equitable health impact across all these different pillars. And you'll see them, and this is again thanks to our outstanding board and thanks to our CEO, Nancy Brown, changing policy, leading breakthroughs through science and technology, transforming healthcare, changing systems, and transforming communities. And so I'm going to give you this one example about blood pressure. What about blood pressure control? It's out of control. I mean, it's really out of control across the United States today. And it's different around different communities that are at the most risk. And so how do we change this? We don't think about it just as how do we go to the patients or how do we go to the individuals most at risk. We think of it through all of those different pillars. And so then I'm going to ask you, how is AI and technology going to change it? I'm going to go at it the same way. We're going to come at it through every one of those different pillars. So for example, we're going to train healthcare professionals from all different backgrounds, Latino, African Americans, gender, LGBTQ+, everything. We're going to come at it from every one of those angles. And so you're being treated by someone that you feel you trust and support and is within your community. And we're also going to come at it from activating patients, teaching them how to be their own advocate. And there's no better place that you've heard it than here today. And American Heart Association can learn from the way that this was set up today by having these really outstanding, strong patient advocates teach us a lot today. And monitoring individuals to measure and track their blood pressure readings. Well, in every community, in lots of communities, you may go into your CVS or into your, the dollar store where there's a blood pressure kiosk, right? I don't know, I'm from rural South Dakota, and there's, if there's anything in a little town of 100, there's a dollar store. I'll tell you, there's a dollar store. And the restaurant is the gas station where they have pizza, and that's where everybody meets for coffee. But they have a dollar store, and in that dollar store is a blood pressure. And that's where everybody goes to get their blood pressure taken. Well, we have to learn to take advantage of those things and help people understand that when their blood pressure goes up 1 point every year, that's significant. Because by the time you are my age and then you get a little bit older, every year makes a difference. And that's not significant to people, but when you think about it, it affects your health. And then empowering communities, organizations to address barriers. We heard a lot about this through, storefronts, faith-based communities coming and helping people really understand how to better engage. So I'm going to skip this slide because I can't read it, you can't read it. Let's just move on. How is AI improving standard of care? So here's the rural health crisis. We talked about this a little bit this morning as well. So you can see the blue line are urban counties and the orange is rural counties. And those are deaths per 100,000, and the years are going out on the or on the x-axis out at the bottom. And you can see rural counties are really behind. The deaths remain there. So how do we combat this? Well, here's a story, a real story that was told through Viz AI, which is a big AI company today. So if you are having a stroke in a town or a rural, out in the country, 3 hours or more from your standard of care, from any hospital, and you go in and you, God bless that there would be a CT scanner there, and they have a CT scan, and there's some AI algorithm and program there that says this person has had a stroke. The best thing they can do then is get you transported immediately to a hospital that can do a procedure, because every second counts. And when this actually happened is a real life story. It really saved a person's life. And the disability, I mean, she was up talking and within a week. And if that's not the case, if they wait around and they have to get this CT scan read by individuals, and then they have to wait around to decide what to do, that's probably not going to be the case. So this also changes the way hospitals are going to be run in the future, right? Because if you think about it, then AI is going to take, it's not going to work by itself, but it is going to work the way hospitals are going to interact, and that they're going to have teams and pipelines, and they're going to act differently. So we have to be thinking about that as well. Some other things I just wanted to bring in, this is my last slide before I say thank you, but the screenings, there's different AI applications, chest x-rays, CT scans, genomics, proteomics, and exhaled breath. We already have AI in every single one of those areas. In diagnosis, radiomics, just a fancy term for x-rays, whole slide imaging. If you ever had any pathology done, which probably everybody in this room did, it went on a slide and it went in some drawer, in some closet, and nobody ever looked at it again. What is happening today is that every one of those slides is being digitized, and that information is being put into a huge data bank that is then being warehoused and used for AI to help people understand, is that breast cancer or is that a different kind of cancer? Breast cancer is not a good example here because of mammograms. But other types of cancer, was that a cancer, was that not a cancer, right? And so they're all digitizing all of those tools. And then you can see the treatments on the right-hand side there. All different AI tools used for that. So these are the key messages I started with at the beginning, and I hope I was able to touch on some of those today. Thank you, and I think I'm gonna hopefully have a fun conversation, I know, with Selena, where she'll probably tell you a lot more than I can tell you, but thank you.
Thanks so much, Dr. Hall. I certainly took notes fast and furiously because I've learned a thing or two. Why don't we start with what a lot of us in this room think about on a daily basis, which is partnership. How do you think that partnerships could play a role in the creation of data sets or in enabling access to new research on AI?
Great question. I know just from experience that, several years ago we created what we called the Precision Medicine Platform. And a lot of organizations and our research scientists, AHA is the second biggest funder after the federal government. We've given over $5 billion in research. And so we created this Precision Medicine Platform with AWS. So they were a great partner for us, Amazon Web Services. and they provide the free research credits for our research scientists to access this. And so that's giving them access to lots of different types of data. So AHA is the trusted third party. And so we go out and get access to data that's de-identified that patients have consented to share with us. And they're usually willing to share it with us because we're using it for research purposes. And so that's an example of kind of an outside the normal area where you'd think that we'd have a partnership, but that's one that's been really useful for us.
Can you share maybe an example where partnership with patients specifically fundamentally changed the trajectory of a data set or a piece of AI research as a direct result of patients being involved?
Yeah, so we, again, this was something that Nancy Brown, our CEO, started, and it was her dream probably 3 or 4 years ago, was to start. We'd had a program that maybe some of you know about called Go Red for Women. And it was really to help women understand that cardiovascular disease is their #1 risk. And it's the #1 killer of women. But there was not a way for women to get involved in clinical trials. We did not have an avenue for them to do that. And I've talked to many of you about this today, and it's something that the AHA is also passionate about and still trying to learn about. So we started something called Research Goes Red. And this was a way to give women, so we have 20,000 women enrolled now, to give them a way for them to tell us what was most important to them, and for them to be involved in research and share their data with us. And so this was a partnership we took on with Verily, and it's been really important for us to learn a lot about these women and what's important to them. And I think Megan from Google said it best, really, is that you have to understand from their point of view what they want to know versus you're starting something and you're trying to force it down their throat, because they really taught us a lot about, you can ask us that in a survey, but we're not going to answer that. Mm-hmm. And then we said, what are your biggest worries? And those worries were very different depending on the age group and depending on the community that they were from. And then we started research in those areas to give back. We said, okay, if you're very worried about, weight and menopause, then we started a research study in that particular area.
When you said 20,000 women, I heard a few gasps in the room because many of our organizations can only dream of that kind of scale. So do you have some advice for organizations like Women Heart and other organizations here who might be interested in getting more involved in these types of initiatives?
I think it's just for us all to come together. Like, what I have learned over the course of my career is that you can't go at it alone. And in the end, it's, we're not doing any patients a service by holding on to things tightly. I think we just want to collaborate and share resources. And so if there's anything that the American Heart Association has that we can share, or share our experiences with others, or that is really important for women, then, or any other community out there, we'd like to share it.
In the context of health justice, how can we perhaps leverage AI to mitigate some of these gender and racial inequities that we see in the system?
Yeah, that's really tough. And I think a lot of it comes from the data that gets fed into the systems, and I know you've heard that before. But sometimes even the data that gets fed in, you think it's fine, but you don't understand that there's bias in the way that it was collected. Like, let me give you a very concrete example. If you are using a risk equation for cardiovascular disease and it was only built on white males, it's obviously going to do poorly on Black women. And I don't know if it's going to predict worse or predict better, but it's probably not going to do well. But if you bring in data from all different types of communities, you know, Black women, Black men, Latino, I mean, every different community, and you have a lot of that different types of data, like hundreds of millions of different data, then that algorithm is going to do much, much better. But again, like Dr. Califf said this morning, it might do well for a year, it might do well for a week, but then the more data that we accumulate, it's just going to do poorly over time unless we keep retraining it. So those are some things we also want to think about. And it's also the quality of the data. So it's not even just the different communities that you think are causing the bias, but it might have been the way in which the question was asked in the first place to the people that data was created. And so if there was bias in that, the way that they particularly asked a question, or if, you know, we heard about it, I think, from Megan, in which her physician said, you know, sort of blew off the screening tool. If that was the way that it was asked, then the data that's in there is biased and you don't even know it. So there's some real issues that are very difficult to overcome, but those are things that hopefully with time we'll learn to find an answer to.
Well, we know that representation is you know, has been an issue for a long, long time, and obviously something that we tackle at Women Heart from a gender perspective. I'm wondering what your folks at the Institute of Precision Medicine and at AHA are doing differently. You know, we talk to our partners, they're challenged by, you know, not having enough women in trials or not having enough folks from different communities in trials. Mm-hmm. So how do you think about this a little bit differently?
We try to bring groups together, at least right now, to get more data combined. We try to collaborate. In fact, we, you know, a week ago, you know, I don't know if some of you probably know the Gordon and Betty Moore Foundation, and they brought us together, and it was one of those meetings where you go, oh, this is absolutely fantastic. And this professor, I was once in a past life a professor at the University of Minnesota and lived this academic life, and it was, you know, like you feel like you're in this small world where nothing else happens, and then you get out in the real world and you're like, wow. But we met with this group, and they have a company, the University of California, Berkeley, this professor, and he started a company, and this company wants to give back to the real world and for public good and for free. And they want to amass a bunch of data that they will then allow people to test their algorithms on. And so if you just tested an algorithm and you were going to take it to the FDA, for example, but you only had to test it on 5 million people, then you could go to this company for free, and they had all of this data, and then they would help you test it and give you a report on what it was that you still could do better or do something. So there's a lot of people out there that want to do good. It's just sort of finding them and figuring out how to take the next steps.
I was really excited to hear about this. You mentioned the company Nuance that Microsoft purchased. And I'm wondering, and it sounds great because we know that physicians and other clinicians are really challenged by the administrative burden of documentation. But I guess the question that popped up for me was what's in it so that it avoids bias?
Yeah, good question. I think they struggle with that, but they must be overcoming it in some good, positive ways. I haven't done enough research to be able to speak to that, and I certainly don't know the company personally, but
yeah.
I mean, even if you follow the teleprompter, I mean, the teleprompter here is partly AI, right? And if you've been following it today, it's good about 95% of the time, but there's 5% of the time where it's missing, and I'm sure there will be new AI tools and new technologies that are developed to help that 5% of the time that it's missing. right? Because whenever someone's name is brought up or a person with a different nationality comes to the microphone, it doesn't do as well. And that's to be expected probably in this first phase. And so, or second phase, there's probably already on its 10th phase now, right? But it's getting better and better. And there's all of these new opportunities for us to engage in this world with all of this new technology. We just have to get our head there about how we're going to do that.
I want to go back to the last session with the patient advocates and those who are thinking about AI in the clinical setting. And I'm wondering, I sat there sort of thinking, wow, the potential for scale is unmatched on the technology side, right? We talked about needing to do better on the analog side, but we know in the digital space, we can scale a lot more easily. And yet, there's that darn issue of trust. So, it's exciting when we think about all the potential that AI has to offer, and yet we've got some real sort of human aspects of interaction with the healthcare system that still plague us today. And I'm just wondering how we make sure that patient voices are included in the development of solutions, while at the same time being respectful of the fact that trust, continues to be the thing that holds us back in some ways.
Yeah, I'm sort of on the, I don't know, it's a really tricky one, but I think this area that we're in, and we have been for some time in other communities that have been distrustful, they've been distrustful for a reason. And we don't ever want to forget that. And so if they're going to hold on to being a little bit distrustful or being a lot distrustful, then that's okay. And we don't want to forget that, but we've got to, I think it's a lot about listening, and we're not going to solve it overnight. I think people, and I know you feel that way too, but it's trying to find a solution to that. I don't know it. I think it's really tricky, but I don't think technology's going to solve it. But I could be wrong.
Well, on the other hand, if we know that there are lots of limitations, and just in terms of the number of providers, let's say, AI does hold, or technology does hold, a lot of promise. So that's sort of where I am. I'm split as well, but I think that if we're trying to reach those in rural America, for example, we've got to lean on AI. Yeah. And we've got to figure out how to do that piece better for more people.
I think so, and I think the patient advocates that we've had here today, Tanisha and others, you said it best, is that we need to activate these patients and help them be their best advocate, because they would want to trust themselves, right? And so if we can help them use some of these new tools that are out there, certainly, to help them understand better what their disease is, to understand what's happening to them, I would think that might be the first step to helping them feel like they can go in to see a clinician. And I love what you said, like, I'm out of here, because he's not listening to me, then I'm going to go find somebody else. And that's empowerment. But if these tools can be empowering to them as well. So maybe that's where it starts.
Well, that's exactly what I think that's the great hope of technology, isn't it? That it becomes a tool for the patient as well as for the provider. Right. Going back to, you mentioned the Go Red for Women initiative, of course, something that Women Heart supports and really respects as a real driver for change for women living with heart disease. And I'm wondering, in the context of that initiative, where you see AI playing an even bigger role in sort of, getting rid of the disparities that currently exist for women's heart outcomes?
Yeah, I think it comes back to activating patients, right? Just giving them a voice. And I think Go Red for Women started by giving women a voice. And now if we can give them a voice with technology to really amplify that voice and give them the tools they need. I think in the beginning we said we're going to give them a voice, but now we need to give them tools to do something about it. Not only get involved in clinical trials and not only get involved in research, but get the help that they need and feel like they're doing it on equal footing, right? Yeah. I think that's our next step.
I think I can speak for a lot of patients and patient advocacy organizations who are probably very timid in engaging in the AI space at all. So what would you say to an organization that's thinking, you know what, we'd love to do a little bit more in that, or a patient who's thinking, I want to learn more about that so I can be an advocate in that space? Where would you direct them?
I would direct them to the experts in the area. Like, I think it was fantastic to hear what Google was doing today to start curating and working with experts and working with advocacy groups, because think how many they showed the numbers. Megan showed the patients that go there first.
Yeah. And
for them to start curating and working with our advocacy groups are really important. So I think some of us can learn a lot from what Google showed today and to start interacting a little bit with them, and for us to interact with each other and talk. And a lot of things grow organically, and I think things like summits like this help us to say, what are you doing? What are you doing? How can we work together? Because you want to be a little bit skeptical there's a lot of companies out there, and you got to be a little bit skeptical of what they're doing, and not always, but sometimes. And it's good if we share stories and come together like this so we know what's happening.
I've got one more question, then I invite the audience to come up to the mics to ask their questions. We've heard all day that health literacy is a real problem. When I was a freshman in high school, I had my health class, and now I know health classes don't really exist anymore. So whose job is it? Whose job is it to improve our health literacy, but also to sort of marry that with technological literacy, which is what is also necessary to take advantage of all of this potential?
That's a good question, and probably one that's 5 years ago, I would have answered very differently than I would have answered today. Because I guess, my kids, I probably could say as a mom, well, it was my job as a mother to teach them their health literacy and their health questions. And, they learned some of that in school, but it really came down to me and their father. But now I'm pretty much 99% sure they're Googling all that. And then the next phase will be a little bit more on the chat GPT side, where they're asking the questions in a chat bot, right? And they're going on different apps. But the question then becomes, what is trustworthy information?
Absolutely.
So that's not an answer. That's just kind of telling you what I think is happening with my kids, which is probably not the gold standard.
But it's a really good way for us to think about that, who is the duty holder of that duty of health literacy, right? We've all raised it all day long as a really important problem, but no one's standing up and saying, oh, I'll take that one. Like, that's my job.
Yeah, that is really a tough one. It'd be good to hear from the audience in terms of what they thought on that one.
Great. There are people making their way to the mic.
Great.
As we speak.
No problem. Good afternoon, everyone. My name is DeJuan Patterson, and I'm a patient advocate as well as an independent consultant as it relates to patient affairs. My question is centered around, as we talk about AI intervention with patient-shared decision-making, I'm curious to hear more about the role of accountability and transparency with the use of AI tools. There may be room for bias elimination as well as reduction in mistrust. So my question is, how much patients are aware of the use and influence of AI in their healthcare services?
That's a good question, and I think it varies. I really think it varies, and I don't think there's a lot of transparency. In fact, I think, and probably a lot of EHR systems today, there's models going on in the background for risk assessment. If you've had a chest x-ray anytime in the last 2 to 5 years, or if you've had a mammogram, if you're a woman, in the last 10 years, AI's been involved. Mm-hmm. And but I guess, it just depends on if you're in the healthcare profession, you probably know that, but if you're not, you probably don't know that. So you're right, there probably needs to be a lot more transparency.
So just real quick, what would you offer up some suggestions for some of the other patient advocacy organizations as it relates to this particular topic area?
I think it's an opportunity, right, for a lot of groups to get out there and to help people become aware of what's happening out there, and for us to come together on some areas, and because a voice together will be stronger.
Great. Thank you.
I'll answer that a little, sort of in a roundabout way. I mean, Women Heart, and I know your organization, other organizations here, partner often with the pharmaceutical and medical device companies. And the quality of that engagement has improved over time, right? 20 years ago when Women Heart was founded, pharma, if there are any pharma folks in the room, I apologize now, but pharma were flush with funds, and the relationship between nonprofits, patient advocacy groups, and the pharmaceutical industry looked a very certain way. Now it looks completely different. And I guess I bring that up as an analogy, potentially, to how our organizations can interact and engage with those who are at the forefront of AI as it relates to healthcare.
Mm-hmm. Thank you.
Hi, Jorge Rodriguez, Brigham and Women's Hospital. A great discussion. My question is around kind of the technology infrastructure on the healthcare system side that's needed to kind of deploy a lot of these tools. So my question is around a lot of our marginalized communities may get care like federally qualified health centers, community health centers that may not be as advanced in their technology. So I'm wondering how might we kind of ensure that as we're deploying these tools, we're sort of not deploying them at like where I work, like academic medical centers, but they also kind of exist outside of that. Thank you.
Yeah, that's a good point that really needs to be touched upon. And I think it's hard to answer that who's responsible for that, right? And how do we do our best to get that? I'm happy to talk with you afterwards. Okay.
Dr. Rodriguez, so Women Heart, we have a program called the National Hospital Alliance. And what we do there is it's a little bit of a sistering of hospitals, where you've got hospitals in sort of the more affluent cities of the US who subsidize, in essence, the participation and activity of the hospitals who may not be able to afford their participation. So I'm thinking that, as individual hospitals go away and health systems really take over our healthcare industry, that kind of sistering or twinning model is probably going to take over as well. And we'll take our last question.
Hi, Adrian Plata from the Hemophilia Federation of America. I guess throughout the day, my main thought has been on these AI intervention sessions has been the question of closed practices in minority groups and how it relates to kind of the solidification of AI in healthcare. You know, when oftentimes when we discuss data science and data, we talk about the holes that exist, you know, whether that's in claims data, emergency room settings, community clinics. But I wonder about how AI can address closed practices in underserved communities or in communities in general that aren't introduced in data, that aren't talked about, that aren't visible to even physicians, but that may be a cause of health disparities or health inequity.
Tough question when we're almost out of time. I will. Now we could ask ChatGPT that question and see what came out, but I think you bring up a really good point, and the best way to go back to that is probably, you know, something that's not going to be a solve it today, but through more training and you know, awareness and education. I don't have an easy answer for that one. It's a really good question and a really tough one to answer. I'm happy to talk to you afterwards as well.
Thank you.
Thanks for the question.
Thank you, everybody. Please join me in thanking Dr. Jennifer Halford for this great
Thank you.
hour. And I think there is a break, and we will be back at 3:30 for your last session. Thank you.
Great.